Hi everyone, today we're reading this paragraph from the book Levinson, and this is concerned with the diseases which are caused by Staphylococcus aureus. Now, this comes under chapter 15, gram-positive cocci. You have of two types, Staphylococcus and you have Streptococcus. The Staphylococcus, they basically appear in grape-like clusters. So they're basically round since it says cocci, so that means it's round, but the appearance or the formation is more of staphylo. Staphylo means grape-like formation in form of clusters, bunches, right? Then streptococci, again cocci, they're round, but strepto, this means that they have chain-like formation. Now, another thing that you need to note is obviously these are gram-positive cocci. Staphylococci, they produce catalase. So they are positive for the catalase test. They produce an enzyme called catalase, and catalase basically converts hydrogen peroxide to oxygen and water, so you'll be able to see the bubbles. So this is done by Staphylococci. And when you talk about Staphylococci, so you have three types. One is Staphylococcus aureus, Staphylococcus saprophyticus, and then you have Staphylococcus epidermidis, right? So aureus is the one that gives you coagulase positive. Then saprophyticus and epidermidis gives you coagulase negative, right? So coagulase is produced in Aureus. So that's also a very important virulence factor as well that we'll discuss later. But right now we're concerned with this paragraph, which is titled as diseases, that says Staphylococcus aureus causes abscesses, various pyogenic infections. Pyogenic means pus causing infections like endocarditis. This is basically inflammation of the heart walls particularly. Septic arthritis and osteomyelitis. Osteomyelitis is infection of bones. Food poisoning, scalded skin syndrome, and toxic shock syndrome. So this is what all is caused by Staphylococcus aureus. There are a lot more as well. So let's just look at them individually. Now, pyogenic pus-producing infection. So Staphylococcus aureus is called a pyogenic bacterium because it attracts neutrophils and it causes pus formation because this is a pyogenic bacterium, right? S. aureus, and it attracts a lot of neutrophils, and this results in pus formation. Example, abscesses are there, boils are there, wound infections, and osteomyelitis. Now, you may be wondering what's an abscess. So you can see this image right here. Abscess is a localized tender collection of pus caused by bacterial infection. Now we know S. aureus, right? Now, what does it do? It attracts a lot of neutrophils. So neutrophils come, it results in swelling, redness, warmth, and intense pain. So this is, you can see abscess formation caused by S. aureus. Now you'll be able to tell what abscess is. Sometimes you also have abscess in gums, in various regions of the body, there can be abscesses. Now, a localized collection of pus surrounded by inflamed tissue. So there is inflamed tissue in the sides, and there will be localized collection of pus. Pus is basically a lot of neutrophils in that area. So dead neutrophils, dead bacteria as well as aureus. Then you have tissue debris fluid, pain, swelling, redness, warm, and fluctuant lump. Okay. Now, S. aureus is the most common cause of skin abscesses. So for that, you'll have to take antibiotics. Endocarditis. This is infection of inner lining of the heart. So endocardium is the innermost lining of the heart, right? Uh, so when there is infection of the inner lining of the heart and particularly of the heart walls, it's called endocarditis. So this is inflammation or infection of the inner lining of the heart, which is endocardium. Bacteria enters the blood, it sticks to the heart walls, and vegetations form. That means by vegetation we mean that bacteria, fibrin, and platelets form. This results in fever, heart murmur, fatigue, emboli. It is highly invasive and can infect even normal heart walls, especially in IV drug users. So the people who are using IV drugs, in them it's very easy to contract S. aureus, and this can result in endocarditis. Now you know what endocarditis is: inflammation or infection of the inner lining of the heart, right? So if you want me to show you an image for that, so let's just look up if there's any image. Endocarditis. So you can see it's basically inflammation of the inner lining of the heart. So there will be, it is especially in people who use IV drugs. So now you know it's caused by S. aureus. Septic arthritis is basically infection of a joint, either of knee, hip, or shoulder. Severe joint pain, swelling, warm fever, unable to move joint. Joint cartilage can be destroyed within days. And who destroys the joint cartilage? It's done by S. aureus. So it's septic arthritis because it's caused by a bacteria. It's not chronic, it's not rheumatoid arthritis, it's not osteoarthritis, it's just because of S. aureus. So this is septic, and this happens within a few days. So you understand that okay, it's very quickly we got arthritis. It's probably because of S. aureus. Osteomyelitis is infection of the bone, and this is most commonly it affects children as well as adults. In children, long bones, and in adults, vertebrae. Symptoms would be bone pain, fever, swelling, and again, S. aureus causes osteomyelitis. It's one of the most prevalent causes. So you can see infection and inflammation of the bone or bone marrow typically caused by bacteria or fungi. Germs can reach the bone with a bloodstream from another part of the body, spread from nearby tissue and enter directly through open wounds or during surgery. That's the reason you have to maintain sterile infection. So this is osteomyelitis of the jaw. So the jawbone is prevalent. This is so scary, right? So osteomyelitis in adults, vertebrae, and in children, long bones. So there'll be swelling and pain. Food poisoning. So, unlike other infections, you do not get sick because bacteria invade your intestine. Instead, you eat food that already contains the preformed enterotoxin, toxin that causes vomiting. So, this is enterotoxin. Now, normally in cream pastries, because obviously they're not heated or whatever, because normally any food that you cooking, the heating process that kills a lot of bacteria. So, when you're eating something that's not, especially if you're in your hostel, if you're living in dorms, and if you're getting mess food, so try to avoid eating anything that's that doesn't go or undergo any cooking process. If you're eating rice and they're cooked properly, you'll know that okay, they underwent a cooking procedure, so the bacteria must have been killed. But if they're giving or serving raita with it, yogurt with it, try to avoid eating that because obviously it doesn't undergo any cooking process. So cream pastries, potato salad, custards, mayonnaise. So, food poisoning, I'm sure many of us have gone through it. Sudden vomiting, nausea, and abdominal cramps. That's what food poisoning is. And it usually begins 1 to 6 hours after eating. So, you can already guess that, okay, I ate that. This is the reason I'm suffering from it. Scarlet skin syndrome, mostly babies and young children get affected by it. It's also caused by S. aureus. Now it produces SOS does what? It produces exfoliative toxin. This toxin breaks the connection between the skin cells. So when the skin cells they're not adhered together, their connection is broken from between them. So the skin is going to peel off as if it's burned. So it will give an illusion like it's burned, even though it's not burned. It's just scalded skin syndrome. But it's peeling off because the connection has been broken down because of the Staphylococcus aureus. So it gives off that kind of burn like skin peels, and the symptoms would be fever, large blisters, skin peeling, obviously, and yeah, then toxic shock syndrome. It's caused by TSST1 toxin. This is a super antigen, and this super antigen is going to cause massive T cell activation, and there'll be a cytokine storm, because of which obviously there'll be high fever, low blood pressure, diffuse rash, skin peeling, shock. This can occur especially in people who use tampons, if the surgical wounds are not cleaned properly, or nasal packing, whose normally nose bleeds, or there's any injury and they use ice packs. So in them also it's very common to get toxic shock syndrome. It's a rare but life-threatening condition caused by bacterial toxins getting into the bloodstream. It presents with sudden high fever, low BP, and sunburn like rash. So these are the three symptoms you need to know. Suddenly there's high fever in toxic shock syndrome. Then there's low BP because obviously the body is in a state of shock, and sunburn like rash. So low BP and the heart is racing. There'll be high fever, and there'll also be, I've already told you, low BP in terms of the shock, right? And there'll be sunburn like rash. So that's important as well. So shock, low BP. Then there'll be high fever. There'll be sunburn like rash. So this is toxic shock syndrome, and it is life-threatening. Hospital-acquired pneumonia. Now they're saying that Saint Aureus, Staphylococcus aureus is one of the most common causes of hospital-acquired pneumonia. Now, nosocomial pneumonia basically is the type of pneumonia that is acquired 48 hours or more after hospital admission. If a person is admitted in the hospital and after 48 hours you witness that a person is experiencing fever, cough, And pus, sputum is there, but it contains pus, and there's difficulty breathing. So it's possible that the person contracted hospital-acquired pneumonia, and this usually occurs in ICU patients, ventilator patients, and MRSA is a major cause. Septicemia is sepsis. Bacteria has entered bloodstream, so septicemia, it multiplies, it spreads everywhere. There'll be fever, there'll be chills, there'll be low BP. So low BP and fever again, chills and rapid heartbeat. So this is septicemia, septic shock. Surgical wound infection, if this occurs after surgery, there'll be redness, pus, swelling, delayed healing. So surgical wound infection, as Aureus commonly infects surgical incisions, orthopedic implants, or pacemaker insertion sites, very important. Why pacemakers? Because pacemakers are foreign bodies, so bacteria are going to form biofilms that protects bacteria from antibiotics and immune cells. So over the pacemakers, the bacteria is going to form its own biofilm. Now, biofilm is something that protects bacteria from antibiotics and body's own defense system, immune cells. Therefore, these infections get very difficult to treat. So I hope you're understanding surgical wound infection. Skin and soft tissue infections. So again, this is SSTIs, which is skin and soft tissue infections. Infections that involve skin and obviously soft tissue like connective tissue. This is in the name itself, but also fat. Folliculitis. This is infection of hair follicles. And these are basically, you can see the images as well in figure 15.3. Infection of a hair follicle, and it basically looks like red tiny pimples that have pus. This normally occurs after either excessive sweating or even after shaving. A lot of people get very disgusting folliculitis. So this is folliculitis. It looks so disgusting, right? So this normally happens. And why does it happen? You can see that there'll be red bumps, there'll be pustules. Why does it happen? That's the question, right? So let's just try to figure that as well. Hair follicles become inflamed and they become infected by S. aureus. It appears as small red pimple like bumps. Then moving forward, so we have covered like a lot of the infections, folliculitis as well, cellulitis, infection of deep skin, subcutaneous tissue. So what is cellulitis? Infection of deep skin or subcutaneous tissue, red, hot, tender, swollen skin. And the margins are poorly defined. So this is cellulitis, you can see. There's also infection by S. aureus. Then you have, okay, so you can either pronounce it like impetigo or impetigo, right? So impetigo or impetigo, whatever way you want to pronounce it. Impetigo or impetigo. So this is impetigo. It normally occurs in kids and it's also caused by S. aureus. Highly contagious, small blisters, a rupture, there's honey-colored crust. It's usually around nose and mouth, and it's caused also by Streptococcus pyogenes, but mostly by S. aureus. You can see honeycomb-like crust. So it looks very disgusting as well. So this is impetigo or impetigo, whatever way you want to pronounce it. Impetigo is British, impetigo is American. Bacterial conjunctivitis, it's infection of conjunctiva. Conjunctiva is, let's see what conjunctiva is. You can see right here. So it's a highly contagious infection. It is treated again by antibiotic or eye drops. And it, unlike viral or allergic pink eye is an allergic thing. But in conjunctivitis, what happens is that the conjunctiva gets inflamed, and this is bacterial, right? You can see the images that there'll be watery discharges. So what's the difference between bacterial and viral? Bacterial Staphylococcus aureus, rapid onset, purulent and mucopurulent because there'll be pus. But in viral, there'll be water that you need to know. And viral, it can spread to the other eye as well, but bacterial is usually bilateral. And yeah, lid swelling is common in bacterial, in viral, it's mild. So in bacterial, there'll be, you can see S. aureus, so you'll have to take antibiotic. Just have a look. This is bacterial conjunctivitis because it's pus. So if pus is involved, that's most probably bacterial. It looks so disgusting, right? And also, let's just once clear what conjunctiva is. It's the inner eyelid. right? So this part you can see right here. You can see, right? So that's conjunctiva fornix, palpebral conjunctiva, and that's bulbar conjunctiva. And you can see it's a thin, semi-transparent mucous membrane that covers the inner surface of the eyelid and the white part of the eyeball. So white part, it also covers the white part of the eyeball, the sclera, that's the white part. So there'll be a thin conjunctiva over it as well, but normally it's over your eyelids, inner and outer, like the inner eyelids, right? Lower and upper, I meant to say. It's a thin, clear mucous membrane that lines the inner eyelids and covers the white part of the eyeball sclera. And yeah, now methicillin-resistant Staphylococcus aureus carries the MECA gene, which produces an altered penicillin binding protein, making it resistant to methicillin and other B-lectin antibiotics. So, in USA, community-acquired MRSA is now the most common cause of skin abscesses. Necrotizing fasciitis. What is this? It's a rapidly spreading infection of the fascia, the connective tissue surrounding the muscles, often called flesh-eating disease because it spreads to the fascia. So this is fasciitis. It looks so disgusting as well, right? So it uh, infects the fascia. Fasciitis, severe pain, rapid swelling, skin discoloration, tissue death, and fever. It requires immediate surgery. Although Streptococcus pyogenes is a classic cause, MRSA can also cause necrotizing fasciitis. MRSA, the methicillin-resistant Staphylococcus aureus. Sepsis is a life-threatening organ dysfunction caused by the body's dysregulated response to an infection. When S. aureus enters the bloodstream and triggers widespread inflammation, organs such as kidneys, lungs, or brain can be affected. So if for example, a lot of SOS has entered the bloodstream and the body is not able to combat it, it's going to trigger widespread inflammation, and major organs like kidneys, lungs, and brain will be affected. So this basically is a life-threatening organ dysfunction, which is caused by body's dysregulated response because the body was not able to timely combat this bacteria. So it results in a very widespread inflammation, fever or low temperature, fast heart rate, rapid breathing, confusion, low BP. This is all sepsis. Why IV drug users get S. aureus infections? Injecting drugs can introduce bacteria from the skin directly into the bloodstream because normally S. aureus, it resides in our nostrils, it resides on the skin, it resides in the throat. So from the skin, it can go into the bloodstream. So that's very important. Whenever IV is given, we normally clean that area with the antiseptic. So this increases the risk of endocarditis. The valves are involved, remember, especially the tricuspid valve. Skin abscesses, you can also remember the inflammation, and there will be pus. Osteomyelitis, the bone infection, and sepsis. As or especially MRSA, what does MRSA result into? It can result into sepsis. MRSA can also result into necrotizing fasciitis. Very important, fasciitis, right? Because Streptococcus is the classic cause for necrotizing fasciitis, but also MRSA can result into necrotizing fasciitis. Okay, so yeah, SRA, especially MRSA, is therefore a common pathogen in intravenous drug users. Modern understanding has clarified this. The cause is now known that certain strains of S. aureus produce toxic shock syndromes. Toxin 1 is a super antigen that triggers massive cytokine release, leading to fever, rash, hypertension, and shock. And you can see these are all the diseases which can be potentially caused by S. aureus. Let's just quickly review it. Abscess, skin and tissues infected, localized pus collection. Endocarditis, heart valves, and was a key feature. Vegetation and murmur. Septic arthritis, joint is affected. Arthritis, joint is affected and it's a painful swollen joint. Osteomyelitis, bone infection, food poisoning, GI tract, rapid vomiting, scaly skin syndrome, skin exfoliative toxin and skin peeling, toxic shock syndrome, whole body, TSST1 super antigen. Hospital acquired pneumonia, lungs, septicemia, bloodstream, surgical wound infection, surgical site, folliculitis, hair follicles, small pustules, cellulitis, deep skin subcutaneous tissue. Then you have impetigo, superficial skin, honey-colored crust, normally occurs in kids. Conjunctivitis, conjunctiva, red eye with purulent discharge, so pus-like discharge. Necrotizing fasciitis, fascia, normally caused by MRSA, which is also known as flesh-eating bacteria. Rapid tissue destruction happens here. Sepsis, whole body infection causing organ dysfunction, right? Uncontrolled widespread inflammation. So yeah, that's pretty much it.